Good afternoon, everyone, and welcome to YACVIC's online webinar. I'm excited to kick off my Young P facilitator career as I was invited to speak at this interesting event where we will be able to have a conversation about the issues of harmful industries, digital marketing to children through YACVIC. Before we begin, I would like to acknowledge the traditional owners of the land in which we all find ourselves today. For me, I am on Wurundjeri country and acknowledge the people of the Kulin Nation. I pay my respects to elders, past, present, and emerging, and the Aboriginal elders of other communities who may be joining us online today. My name is Rakea, and I'm currently a student studying public health. I'm one of 7 amazing peer facilitators with YACVIC. My interest of joining the health sector stems from experiencing what it means to be a first-generation Somali Australian and having refugee parents seeking a better life. Being a young person who is constantly scrolling on social media and having younger siblings, I'm worried about the harmful ads and pop-ups of unhealthy fast food and alcohol. I can't tell you the amount of times I've come across ads for McDonald's on social media and Snapchat and definitely trapped us and lured us to the nearest joint. Today, I am excited that we are also the first to hear about VicHealth's new report, Under the Radar, Harmful Industries, Digital Marketing to Australian Children. This report brings together information that we often see presented as separate issues. For example, just alcohol marketing or just unhealthy food marketing. But at the end of the day, harmful industries all use the same tactics to profit from their products at the expense of children and young people's health. Now, I'll just run through some housekeeping. Firstly, if you're like me and love to share your activities through social media channels, you can join the conversation by using the hashtag harmful industries. And secondly, when the panel section of today's event begins, we invite you to share any questions through Slido. A reminder that we will not be able to get through all the submitted questions, but do hope to be able to answer the most rated. Now, I'd like to introduce Dr. Sandro Di Maio, CEO of VicHealth, to formally launch this new report.
Thanks very much, Rakia. Just like Rakia, I didn't realise we're neighbours. I too would like to acknowledge the traditional custodians' land that I'm on today, also the Wurundjeri people of the Kulin Nation and their elders past, present and emerging, and any First Nations, Victorians or Australians tuning into this session today with us. Thank you also, Rakia, not only for a fabulous opening and for joining us to chair this discussion today, but also for providing your own personal experiences as a young person in Australia and some of the challenges that you have faced in terms of digital advertising. Well, in the lead up to World Children's Day, it's never been more important to talk about children's rights in the digital world. VicHealth is excited to launch today a new report, Under the Radar, Harmful Industries, Digital Marketing to Australian Children, which aims to unpack the pervasive and pernicious tactics used by gambling, alcohol, and unhealthy food and beverage companies to target kids online. We're grateful to have worked with the Obesity Policy Coalition and would like to acknowledge Jane's leadership and the Foundation for Alcohol Research and Education. Thank you, Trish, and also to Katarina and the team. And of course, the Victorian Responsible Gambling Foundation. And thank you also for Margaret for joining us today. I'll begin today's event by providing a high-level overview of the report. I'm sure many of you can appreciate how nuanced and packed this report is and this area of public health is, but I'll try and give you an overview. And as Rakia said, this report really tries to bring under one roof some common challenges across a number of often siloed public health areas. Australian children are engaging with technology more than ever before. In 2020, during the coronavirus pandemic, the digital world has cemented itself as a foundational element of children's lives. Children have had to rely on digital technology for education, social connection, and entertainment in a way like never before. 2/3 of 6 to 13-year-olds either own or have access to a smartphone, and 94% of 14 to 17-year-olds have a smartphone. YouTube, the most popular form of social media, is used by 86% of teenagers and 80% of children aged 8 to 12. Children's right to participate in the digital world must be balanced with their right to be protected from harms when they navigate online spaces. This harm is particularly clear in children and adolescents, as they're more susceptible to the marketing of harmful products. Children do not always recognise marketing and understand its pervasive content. Indeed, adults don't either, let's be honest. And including for harmful products like alcohol, gambling, and of course, unhealthy food and beverages. This is especially alarming when we know that this marketing is effective, highly effective, and the more marketing for alcohol, gambling, and unhealthy food items and products that children are exposed to, the more likely they are to try these products. Digital marketing of harmful products drives risky behaviours that in turn leads to poorer health outcomes, both today and well into the future for Australians. While children explore, learn and connect online, they're surrounded by digital marketing of harmful products via websites, social media, gaming and influencers. And I have to say, as an uncle, even for me reading this report, understanding all of the different ways that children are being influenced and reached through marketing, even I found it surprising. There are ways in which children are interacting in the digital space that as an adult today, I don't even fully understand and comprehend. And I think it's an area of public health that we have a lot of work to do to understand, and certainly a long way to go to properly regulate and put the safeguards in place. Harmful industries use a range of digital marketing techniques that flout the limited safeguards that are currently in place. Digital marketing is ubiquitous and appealing, and let's be honest, companies wouldn't do it if it wasn't and if it didn't work. Marketing can be delivered through what feels like quite traditional routes like branded websites and pages on social media, where branded content is shared and liked and endorsed through personal experience and sharing. While signing up for social media sites are often theoretically only for older children, these can be easily circumvented, as can age verification on branded websites or advert games that are technically only for older children or users. Increasingly, harmful industries are using more subtle and covert marketing by influencers or approaches that encourage sharing engaging content and content among peers through games and even challenges. Astroturfing is becoming a big problem, where popular influencers are paid to casually talk about branded products on their channels without even indicating that this is anything other than a genuine endorsement on their part, and that in fact money is exchanging hands or products behind closed doors. Influencers are also free to share whatever they like, and children are likely to do and to want to follow and emulate those that they admire. This is normal in the development of a child. Marketing is also increasingly targeted. It's not by chance that when we visit our favourite websites, the ads that pop up on that site are those for things that we have shown interest in the past, even talked about in our living rooms in the days leading up to landing on that website. Our data is being monetised and used to direct these ads in real time. In effect, we are paying with our attention and our eyeballs. And an extension of that is we are paying with the attention and eyeballs of our children. This is also happening in an out-of-home setting. Overseas, we're seeing digital billboards that respond to our phones and delivering ads that are based on information that our phones tell the billboards we're passing. The problem is that there is a huge gap between the level of protection afforded to our children and the reality in which they now live. Our children are digital natives. They inhabit a world in a way that most of us don't, but the brands certainly do understand, and then they exploit. Australia is failing the children, our own children, from harmful digital marketing. The various codes that oversee the marketing of harmful products are industry designed and industry led, putting industry profits over children's health and well-being. Alcohol marketing is governed by the ABAC Responsible Alcohol Marketing Code, which is voluntary. I'm sure my colleagues from FAIR will talk more about this in a moment. The food industry codes fail to protect children for a number of reasons. They apply only to children up to 12 or to children up to 14 years for fast food codes. Again, I'm sure Jane will talk more about this in a moment. And similar loopholes exist for gambling and for other products. In addition, there has been a proliferation of gambling-like content, including games and online gaming influencers who have audiences of millions who promote gambling and alcohol and unhealthy products in their own online streams. Central to these codes are complaints mechanisms which are not fit for purpose in the digital age, ironically, either. When the majority of advertising for harmful products was on TV or in the newspapers, it was easier to monitor because most people saw the content and the records of that content could be collected. This is no longer the case. We need to recognise that children see different marketing to adults, even sitting right beside them, and the parents aren't able to monitor what their children see online because of the sophisticated marketing algorithms now employed. This means that our complaint-based mechanisms are not fit for profit because often parents won't know what marketing their children have been exposed to. Australia is also lagging behind many other countries around the world. Finland and France are both restricting alcohol advertising on social media. And in Italy, there is a complete ban on marketing of gambling products and services. In the UK, an age-appropriate design code, the first of its kind in the world, sets out 15 standards for online services that ensure data collection from children is minimised as a default. And we've just seen the UK announce a total ban of online advertising of junk food. The protection of children's privacy is central and needs to be taken across these three sectors. The platforms, Google, Instagram, YouTube, the ad agencies to ensure that the system that they use are transparent and can protect children's online privacy and exposure, and the harmful industries themselves to ensure that children cannot be exposed to and targeted with harmful marketing online. And more importantly, we need to involve young people in their voices and concerns as we shape our response. And this is a critical point. Involving young people themselves is essential, which is why we're so incredibly excited today to have both Rakia and Aggie with us. The voices of young people are imperative to the issues and navigating how we, as public health stakeholders, take meaningful and sustained action that will benefit and protect children and young people from harmful marketing long term. Harmful industries have capitalised on advances in technology to collect and use information on children's online behaviour to better target their marketing. There are also streets ahead in terms of current regulation. When we build back better, we need to learn from other parts of the world and put children's perspectives and rights at the very centre of efforts to protect them.
Thank you.
We need to work towards a very different paradigm of the digital landscape we live in today. And this begins by making sure that children's online privacy is protected, to ensure that their data isn't collected and used for the purposes of marketing unhealthy food, alcohol and gambling products. Just once again, thank you very much to Rakia and Aggie. Thank you to the YACVIC team and thank you to our partners for making this launch and this important report possible. Back to you, Rakia.
Thank you, Sandro, for the insightful overview of how harmful industries are reaching kids today. I definitely got a little bit too excited there. I can definitely resonate with protecting, regulating, and safeguarding digital marketing, especially for our future as youth and for the coming generations. I'd now like to introduce Jo Jewell. Jo is a nutrition specialist from the UNICEF and will present on the importance of having children's rights at the forefront of this discussion.
Hi everybody, greetings from New York. My name is Joe Jewell. I'm a nutrition specialist at UNICEF working on the prevention of overweight and obesity in children and adolescents. This week, we as UNICEF and a global community have been celebrating World Children's Day, a really important moment of the year to reflect on some of the most important challenges facing children around the world. It's a great honor to join VicHealth today to discuss the issue of digital marketing to children, and I want to congratulate them on an excellent report. My contribution today is going to reflect upon how, as a community, we can use a child rights approach to further our political objectives in this space. It's worth spending a little bit of time answering the question, why is digital marketing a child rights issue? It is undeniable that the internet and digital technologies have transformed children's lives. New modes of communication, educational tools, and information resources place an abundance of knowledge and the power of exploration in children's hands. We know that increasingly, almost every aspect of children's lives will be mediated through some aspect of online participation, whether that is education, play, relationships with other children and family members, commerce and work. While on the one hand these bring massive opportunities, we also know that it brings risk. Children are developmentally vulnerable, but they are also routinely targeted with marketing that exploits their vulnerability and uses the social networks, video sharing, and games that are particularly popular with children. There's also an added dimension which doesn't relate to the content, but relates to the means with which digital marketing is facilitated, and that relates to children's right to privacy and the protection of their personal data. Why is digital marketing wrapped up in all these issues? Well, because it's based fundamentally on the collection of children's data and sharing it with third party. We know that websites and apps used by children collect a lot of information to refine the marketing that is targeted at them, and then these websites also share children's personal data with third parties. Children are reached by digital marketing through a variety of different avenues and channels. We know that they are present on social media, they enjoy using social media, and that's one of the places where they're most targeted, but they also are exposed to marketing through branded environments and advert games, and of course influencer marketing that uses not only adult influencers, but sadly also uses child influencers. So what is the value of the UN Convention on the Rights of Child, and what does it bring to the conversation about how we can address this issue? The most important part of this debate is that the convention says childhood is separate from adulthood and we need to treat children differently and give them extra protections. Childhood lasts up until 18. It is a special protected time in which children must be allowed to grow, learn, play, develop, and flourish with dignity. So many of the conversations around digital marketing to date, whether it is in food or other areas, have actually not complied with that principle. We see many of the existing policies only protecting children up to 12, and UNICEF is absolutely adamant that a child should be protected up until the age of 18. There are further other dimensions of a child rights approach that are worth spending a couple of seconds on. Firstly, the Convention on the Right of the Child defines children as right holders and governments as the corresponding duty bearers. This brings responsibility for governments to always consider the best interest of the child in all matters affecting them. It also emphasizes that the standards and principles derived from international human rights treaties should guide all policies that have potential impacts on children. We believe, as UNICEF, that applying a child rights approach to restricting digital marketing of children will help governments, will help communities put in place more accountability. It brings legitimacy to the discussion, and it can be a useful advocacy tool to empower work in this area. What are the main reasons why we think that you should be using and considering a child rights approach in your efforts here? Firstly, we believe that the current practices have negative implications for children from a privacy and protection of personal information perspective, protection from economic exploitation perspective, and of course the fact that digital marketing is taking place actually undermines children's ability to participate online in a healthy and constructive way, and therefore it actually undermines freedom of expression and access to diverse information. And what I mean here is that if we are concerned about children participating online because of digital marketing, they're unable to take advantage of all the opportunities that it brings. And of course, coming from a public health nutrition perspective, the right to adequate nutrition and health is also undermined. What is UNICEF's role and how can we support efforts in this space? We believe it is the responsibility of governments around the world to prioritise children's health and safety, and to also, as I mentioned before, consider the best interests of the child in all policies. What we are advocating and creating guidance for as UNICEF is that governments adopt a child rights-based approach and restrict marketing, ideally through legislative measures. And we also want to see the integration of child rights into all global corporate policies and practices across the digital marketing chain. I want to draw your attention to a couple of resources here that may be useful for you, and thank you for the opportunity to speak to you today. Thank you. Bye-bye.
I'd like to now introduce Introducingggie Moreno to talk about what it's like growing up as a digital native. Aggie joins us today as a passionate youth representative with a Filipino heritage. Currently studying youth work, Aggie has held multiple volunteer and professional roles working to advocate and explore issues affecting young people. One of these include VicHealth's Top Spin program that called out the sneaky marketing tactics used by alcohol industry and aligns strongly with our discussion today.
Hi, everyone, and thank you, Raquia, for that introduction. I'm Aggie, and I use she, her pronouns. And today I'll be reflecting on what it's like to grow up as a digital native. So I'd like to start with my experience with tech. So tech has always been very present in my life, like things like radio, TV, and computers. So the one thing that they've always had in common is advertisements. So companies always had something to sell to me and the general public. In my years of education, they also taught us how to use these technologies, which was interesting to see. And it was also interesting to see the evolution of smartphones and smart devices. As tech progressed over the years, especially with the increased use of smart devices, companies have developed programs that are able to grab our personal information and use targeted ads to reach us. As tech gets smarter, it learns more about us. And seeing that transition growing up was interesting to see. And I would like to now move on to the effects of social media on my mental health. As I was exposed to more social media, and especially in this current situation that we're in, I was seeing more ads and I was seeing more information and everything more like more news. And it became very overwhelming for me. I ended up deleting most of my social media and spending less time online to get my mental health back on track. And I felt that my mental state was having negative effects on other aspects of my life. This is still something I'm trying to navigate, but I do feel I have the right supports in place from my family, friends, and resources provided for young people. Many people have expressed this same feeling around me because of the constant exposure to social media as well. And some of the examples of the types of marketing I was exposed to was mainly ads on Instagram, YouTube, affiliate links to promotions and products, social media influencers endorsing products and certain lifestyles, games and apps encouraging to use my money to gain access to certain features on their apps as well. So all of this, my lived experience, and provides the context of how I see things. And moving on to my reaction of VicHealth's report, it's made me feel a sense of urgency for these issues. I think everyone needs to be more mindful of these things, of the marketing techniques, especially to get that are getting more invasive and more personalized. As I've grown up, I have noticed that these issues are very prevalent. The gambling, alcohol, and unhealthy eating habits are very present in Australian culture. And I feel it's an issue that greatly affects the general population, especially young people. Reading about the processes and codes that regulate the industry make me feel like they're very outdated and overgeneralized, which leaves young people vulnerable. And as a young person, I feel like the government needs to take more responsibility and regulate the content being put out there and keep the industries accountable for these things. Especially with the coronavirus pandemic, these issues have grown exponentially out of control, and we are yet to see the long-term effects of these things on society and young people. Finally, my stance is with Yakvik on this one. I think we need to take more action, as I feel like these issues need to be a priority for our society and for the government as well. And things overall need there's an urgency for the need of reform. And thank you. That's all I have for today.
Thank you, Aggie. I can completely identify with many insights that you have shared. I love the term you use, digital native. We often do get sucked into social media and companies that want us to constantly conform to social standards to fit in. Yeah. Now, I'd like to introduce our amazing panel today, who all are contributing in meaningful ways to address the problem of harmful marketing to children. Once again, we have Aggie joining us to provide further reflections. Joining Aggie, we have Jane Martin. Jane is the Executive Manager of the Obesity Policy Coalition and Alcohol and Obesity Programs at Cancer Council Victoria. The Obesity Policy Coalition is a powerful advocate for policy and regulatory reform to prevent overweight and obesity, with a focus on food marketing, labeling, and pricing measures. We also have Trish Hepworth. Trish is the Director of Policy and Research for the Foundation of Alcohol Research and Education, where she and her team with people and communities towards an Australia free from alcohol and harm. And finally, we are excited to have Margaret Quixley. Margaret is a campaign director at the Alliance of Gambling Reform. She leads the Alliance work to prevent and reduce harm from sports gambling, specifically focused on eliminating gambling advertising. To kick things off, we will be beginning this questionnaire with Jane. How are unhealthy food companies targeting children, and how does that differ from alcohol or gambling?
Thanks, Rukia, and thank you very much to VicHealth and partners for having me today and talking about this really important discussion. And great to hear from Aggie and Rukia about their experience in the digital world, because as older, not so native, digitally native participants, a lot of what's happening online that children are being exposed to, including very young children, we don't see. Parents aren't seeing this. They don't have a line of sight. That's very deliberate, but I think it's very concerning because the nature and size of the problem is not evident. And that's why this report is so important and this discussion is really critical. And we've done a lot of exploration of how the codes developed by industry for themselves work, and they work poorly. It's the equivalent of putting Dracula in charge of the blood bank. It's not designed to protect children, and as such, it doesn't offer protection. So it's very important that government steps in, and also that there's high support for this to happen. And back to the question, unlike gambling and alcohol, there is very direct targeting of children on digital platforms. And there's a lot of novel, very immersive technologies used, such as food-themed game applications or apps, which deliver marketing to children anytime on portable devices. And these games are very clearly aiming at very young children. The Magic Kinder Studio app is designed for children aged 3 and over. The McDonald's Happy Meal app is designed for children aged 4 years old and over. So it's not just this traditional purchased advertising that's coming up in children's Facebook feeds, which looks very similar to what we would see, but there's a lot of advertising that's embedded, entertainment developed as which is advertising but made to look like entertainment. And as has already mentioned, children don't know the difference. The other sort of element is that digital media platforms like Facebook, Google, YouTube give marketers data that is then used to target children based on how they engage online. And the tracking includes geo-tracking on smartphones, and marketers are building these really extensive profiles of anyone who's using the internet, including these very small children, and marketing their messaging. And it's absolutely unprecedented. The other way that marketers are really engaging and developing a relationship with our children is having these very fine-grained analyses of how children behave. And then they can seek and locate and identify who's susceptible to their messages. And they follow children throughout the day when they're happy, sad, frustrated, hungry, and deliver marketing which has the maximum impact. So they aim to engage children in emotional and entertaining experiences and encourage them to share these with friends. And many of you will be familiar with the Share a Coke campaign. That was very powerful. If children are getting marketing messages from their friends, it makes it a lot more powerful and influential than just paid, obvious, clear commercial advertising. And fun is a very strong theme, and it's interesting hearing Aggie's experience of being online, but a lot of these experiences are put for our children to play and engage with. Fun is a really strong theme, and it masks the true intent of this material, which is to increase sales, which is develop lifelong consumers for these processed food companies. That's what they're aiming to do. It's all about the bottom line, and it can make it very confusing and misleading for children.
Thank you, Jane. Considering the panel section of today's event has already begun, we invite everybody to share any questions through Slido. Again, a reminder that we will not be able to get through to all the submitted questions, but do hope to be able to answer the most rated. On that note, Margaret, what are some of the common practices used by harmful industries, and can you provide some examples of how children are targeted or exposed?
Thanks, Rukia, and thanks to VicHealth for hosting this event. It's a really timely and important discussion to be having. We've seen some really worrying examples of targeting children online, and similarly to the offline space. The first example I wanted to draw your attention to is the brand association in terms of direct marketing. So we see this being used by gambling companies in terms of latching on to family-friendly brands to really socialise from an early age. In the case of the AFL, you know, that in the offline space, that is physical marketing around the boundary of the game. On the online space, we've been really disappointed to see, you know, there's similar Bet Easy, now sports bet marketing appearing on the AFL website at actually under 18s targeted pages. So recruitment pages where under 18 players will be going to see if they've been picked up by a club. We've actually had screenshots taken of Bet Easy marketing appearing on those pages. So if nothing else, it's certainly reckless, but we would argue that it is targeted and needs to be like seriously addressed. I think in terms of like what Jane was speaking of, obviously it's appearing indiscriminately, and Aggie touched on it in news feeds, on YouTube clips. But what we're really concerned about is that indirect marketing, that real socialization, the peer-to-peer, the use of influencers. Particularly, we've seen during COVID, we saw Brendan Favola promoting gambling apps on his new Instagram stories. And this is a person who was actually harmed by gambling himself, which was really disappointing to see. We know that a lot of sporting personalities attach themselves to branding and through direct and indirect marketing, people like Ricky Ponting. But we've also seen, this really insidious forms of promotion and that peer-to-peer marketing in the lead up to the grand final. We saw Neds using Carol Baskin in a cameo to promote, to latch onto that, popular pop culture moment to promote the Tigers v Lions preliminary final. And that was obviously no mention of gambling in that ad, but obviously the branding was there and the sharing opportunity among. So it's that really subtle forms of advertising that we're seeing and particularly worried about. And that astroturfing that we were speaking about earlier, in terms of particularly during COVID, we saw Sportsbet pick up and latch on to, this meme culture that they're really great at identifying and not even directly pushing their own product, but tapping into the zeitgeist of young people and their interests, and certainly particularly using a comedy positioning to share their content and their branding without actually directly pushing advertising per se. I think what's quite unique in the space of gambling is we have, obviously loot boxes appearing is really commonplace in games, which are essentially just randomized rewards. And so they replicate poker machines in terms of the reward structure. And we see the same thing in terms of even just the social media, the structure, the way that social media newsfeed operates is similarly tapping into the reward incentive that's used in poker machine technology. And so for us, it's really about just that normalization and I guess the grooming of children essentially. And it's particularly worrying given, as been mentioned by earlier, that parents really don't have line of sight, and it's really, invisible to many of us.
Thank you, Margaret. Trish, in the report, it touches on online gaming. How are harmful industries using online gaming and esports to reach children and young people?
Thanks, Rukia. And again, thanks to VicHealth and everyone who's both contributed to this report and everybody tuning in. It's a really important subject, and it's great to know that you are all interested in tuning in today. Esports and gaming is actually a really interesting area. We've known, obviously, for a long time that traditional sports have been a favourite place for unhealthy commodities, so junk food, unhealthy foods and alcohol and gambling. And it's been interesting to watch a very similar migration as esports have really gathered up. We did some research with the University of Queensland last year, actually looking into people who were particularly involved in esports. And one of the things that we found is that they have a high percentage of ad blockers. So the people who are heavy watchers or heavy players of esports are actually taking active steps to try and reduce the amount of advertising. But the consequence of that is not that they see less advertising, but that the advertising has moved. So we are seeing huge moves into product placement, and quite often sort of specified product placement. It's not announced as advertising, sponsorship. We're even seeing sort of guerrilla marketing in chat rooms. So a recent study of Twitch, for example, which is a communication technology that sits alongside a lot of gaming, found that sugary drinks was one of the most commonly talked about things. So you're seeing this really under the radar guerrilla marketing. One of the things the research also showed were people who were identified as likely having a gaming addiction were also more likely to report seeing ads for alcohol, and were also more likely to view them favourably, and in particular, view them favourably when they were sponsorship or product placement or announcements or endorsements from their key players. So there's some really unhealthy loops that are deliberately being played upon around embedding people who potentially have a problem with are more susceptible to developing addiction to gaming with some other addictive products. So alcohol, we found very similar things to gambling and energy drinks and other unhealthy foods. And I guess that's one of those other things too, is you sit there and you think, as others have touched upon, well, what happens to all of this data? So these loops are deliberately being fostered and sometimes just you don't have to actively go out to make them happen. The whole system is designed up to get these horrible loops to find what the industry will call your high value customers, and which other people may say are people who have a gaming addiction or people who have an alcohol use disorder. Another bit of research that was definitely not university research, because I would never have got ethics approval for it, for example. We were trying to look into what was happening that talks to the data collection point. We were trying to work out what was happening with catch-up TV. So as TV moved more online, and I had a 13-year-old who was at home during school holidays, and I said, look, just send me an email every time you see an alcohol ad. And so I get into work and there's this email at 9:30 and it says, watching Bondi Vet on 7+ or something, saw an ad for Johnny Walker. And then you get another one sort of half an hour later that said, watching RSPCA Pet Rescue, do you know that Bundaberg makes alcohol? And I'm like, well, yeah, I did, but nice to know that you didn't. And by day 2, I went into a meeting and I just came back to this stream of things. It's like, saw a Johnny Walker ad, saw a Bundaberg ad, saw a Wolf Blast ad. And she's like, and there's just this one that goes, now all of the ads are alcohol, and I think it's because I'm clicking on them. And I'm like, yeah, that's it. And it was at that point I was like, also, you're clicking on them, and we have got to stop that, because somewhere already there is a tag on my 13-year-old that says this is somebody who is interested in alcohol. And that tag is stuck with her forever. She can't go in and find out what that actually says. She can't go in and say, look, it wasn't actually that I liked Bundaberg. I didn't even know they made alcohol, but I had to do it for my mum's stupid job. That information is now stuck with her. And when you're looking at some of these ecosystems where you've got people who are getting these tags, it says somebody who potentially has a gaming addiction, somebody who's very interested in alcohol, someone who's interested in gaming. And they all feed into each other, and there is no recourse to change any of that information.
Thank you, Trish. And Aggie, how normal is marketing for these products in the daily lives of people your age?
Great question. Because young people are the most tech savvy with these things, we are more likely to be exposed to online marketing and general marketing in real life and things like that. We are exposed to it constantly. There's no escaping it. If it's not by a company, then it's done by our friends, our family, and who use these products and recommend them to us. And also when you search for things online, like in Google, it pops up for you on Instagram and Facebook. So truly, we are never not without marketing in our lives. It's always there, and it's everywhere. So I think it is over-normalized in young people's lives, especially as digital natives.
Thanks, Aggie. Now we're going to jump to the top questions in Slido, and we will see how many we can get through. First one that came up was for Jane. How can we fight fire with fire when health promotion marketing budgets are a fraction of those used by harmful industries?
A great question, and I think it's very difficult to do that. I think it would be very expensive. We're dealing with companies with huge budgets. And I think if we, that's ignoring the problem that children should not be targeted by these companies. They in fact say they don't market to children, but they do. And we should protect children because they're vulnerable. And we have a huge problem with unhealthy diets that's been driven by this marketing because it works and it's insidious and it's grooming our children and setting them up for diseases like cancer and type 2 diabetes when they're older if they move into an unhealthy weight category. So I think it's a nice idea that advertisers would be happy, but I think the best way forward would be to truly protect children and remove this really influential and persuasive marketing altogether.
Thank you, Jane. And another question to Trish. What does best practice legislation look like? What do we need to advocate to our decision makers, harmful industries?
Thanks, Rakia, and I do feel this is probably an excellent throwaway to say, please read the report. It's got some very good ideas in there that we spent a lot of time thinking about, and obviously drawing on the wisdom from people all over the world. There are a number of ways to tackle this, but I think one of the key things to think about is you've got to get to every point in the system. So we need something that is actually directed at the advertisers themselves. It is not okay to target children with products that will decrease their health and will increase their risk. So there needs to be something that goes back to the people who are directly profiting from this advertising, and some controls put in place there. And they have to stop being able to write their own rule book, because, for example, as I was talking about sponsorship before, in the alcohol rule book written by the alcohol company, sponsorship is explicitly excluded as something that code covers, despite the fact it's one of their major advertising systems. So we've got to target those advertisers with proper rules. We need to do something around the platforms. The platforms are the ones that are currently taking in all of this data. Even if we put in some constraints around what the advertisers can do, those platforms will still know when those kids are showing signs that they might be interested in gambling. We know, for example, that Facebook was tagging 16-year-olds in Europe as interested in gambling and 16-year-olds as interested in alcohol. And even if you put in something that stopped them using that information to kids who were, when they were, say, 16, what's to stop them suddenly, when they turn 18, going, well, here is our targeted horde of most acceptable customers, we're going to go for those. And indeed, I know in gambling, we've got some evidence that that's exactly what they're doing. And we need to put in some better principles around the entire advertising infrastructure. So all those people who sell advertising space and make the market work, there's a really strong point of control in there. So I think the key thing is that we have to hit all three of those. The other option is to go definitely down, and that's, I guess the other option is just to say, well, maybe the best thing we could do is say, well, if we can't find a way to make this work, we just don't have it. You can't advertise for alcohol. You can't advertise for gambling. You can't advertise for unhealthy foods. If you can't show me that you can do this in a way that keeps kids safe, then we just don't do it.
Thank you, Trish. And Margaret, today and in the report, it talks about a lot about social media in particular. Should the social media brands have to manage their user base to verify that all users are 18 and over?
Thanks for the question. I think there's definitely a more proactive role that social media platforms certainly need to step into. The reality is that there's a patchwork of legislation and loopholes. And in the case of guidelines, we know, for example, if you're in Australia, you're not exposed to tobacco advertising. And that's because there's a really strong legislative framework preventing that. But if you go on social media or Facebook in Asia, for example, you will receive tobacco ads. So that is the key example that we can point to. It is possible to regulate. It is possible to actually protect children and to eliminate these forms of ads. And just to echo Trish's point, if the industry cannot prove that they are not harming children, that is the onus is on them to prove that they are not targeting and not harming children. And if they cannot, then they should not be able to advertise at all. I think that there is a role for users in this space as well. I think that, Facebook and others are private companies. They respond to the bottom line, and there is a role for the community to play in advocacy, in actually pressuring the social media companies to do better, because they have a really different standards when it comes to gambling, alcohol, and junk food, and even those standards aren't aligned across the board. So in terms of verifying users, to be honest, the platforms already know how old you are. They already have the data. We need them to step into the space and to better protect young people, and that starts with people power, but it also is the responsibility of governments and the industry to take responsibility to make sure that young people aren't being targeted. It's not always on us as community organisations and representatives of the people and children who are impacted to prove the harm. It's on them to prove that they're not being harmed.
Thank you, Margaret. This is all we have for questions today. Thank you to our panel members, Aggie, Jane, Trish, and Margaret, for your insights, as well as being a part of this collective group who are really bringing this to the forefront for health promotion in Victoria. Before I close this event, I'll throw back to Dr. Sandro Di Maio. VicHealth CEO for his closing remarks.
Thanks very much, Rakia. And thank you also, Aggie, and to our incredible panel. Look, I just want to reiterate how great it's been to have both of you in particular to participate in today's event. VicHealth is really proud of its relationship and its collaborations with YACVIC, but particularly so of young people like yourselves, leaders who, it's really critical to have your voice at the table, and not just at the table, but really leading the discussion today, setting the agenda. So thank you so much, Rakia and Aggie. Look, it's been a packed session, and it is a very packed document. So just echo what we've said a number of times, to please have a moment over the weekend to read the report, reflect, and also if you want further information, please feel free to reach out to VicHealth or to our partners. A lot of really critical elements have come up in this discussion and in the panel today. And like Rakia, I think you put it very well, you feel energised and a bit outraged and ready to, create some noise and some change. And I have to say, after listening to our incredible panel, I feel the same. Thinking that by the age of 13 years, an Australian child could have up to 72 million data points collected on their lives, on their preferences, on their locations, their friends, their feelings, it just staggers me and frightens me. And as a public health leader, the idea, as Jane said, that you could have children having advertising target not just them specifically, but the location that they're at that moment, the feelings that they're having at that moment, whether they're hungry or tired, the challenges they're facing, really preying on their vulnerabilities, and the exact time of day and the exact product is frightening. The level of complexity, of subtlety, the predatory nature, the pernicious nature of online digital advertising, the use of influencers, the use of games, the use of filters, the example from the recent grand final of being able to provide, having a filter on Snapchat, a program we know young people are using more than any other demographic, that allows you to overlay yourself with a gambling filter. These things just should not be possible and should not be allowed. We have a lot of work to do to understand the technologies themselves. There were technologies named even today I've never heard of, and I don't feel like I'm that out of the loop, but we clearly have a lot to learn. The marketing techniques themselves, we have a lot of work to advocate, and we have a lot of work to do to even catch up to the rest of the world, let alone lead the world as we do in other areas of public health. And ultimately, I think really for me, a take home of today, Joe's words really resonated as well, and they were echoed by Margaret at the end. Proof of not doing harm needs to be the starting point. This is a child rights issue. When you are talking about, commodifying and selling off the attention and interests of young children to the highest bidder, that is a child rights issue, and it's something that we need to work very hard to change. So as public health stakeholders, we need to continue to work together. I think finding our points of commonality across common public health issues. That's why VicHealth and FARE will be bringing together partners across the food, alcohol and gambling sector to work towards developing a policy consensus for harmful industry marketing across digital platforms. And we really will continue to work to make sure that governments, and particularly federal government, prioritises our children and their well-being amongst above industry profits, and particularly the challenges that coronavirus recovery present, as well as the opportunities. The marketing tactics used across these three industries are common. There are great opportunities for us to continue to work together. And I think, one of the takeaways of today is that we must continue to take this very seriously. And we are stronger if we work together across sectors to create a digital and regulatory environment in which these tactics can no longer thrive and hopefully one day no longer exist. I'll hand back, I think, to Rakia. Is that right?
Yes, thank you, Sandro. I just wanted to really thank YACVIC and thank VicHealth for giving me this opportunity to be here today, especially being a fresh face to YACVIC, just being 3 weeks into work and having this amazing opportunity to sit in, listen, learn, and just definitely benefit from everything that has been said today. I look forward to everything being implemented in the future and seeing a change. I'm really excited today that I was given this opportunity again to host this event. Like so many people my age, these topics and conversations are something I'm interested in. And to also have a young person on this panel, it feels great to feel that we can be a key voice in this discussion. Thank you again to all our speakers, our panel, and for all of you joining us today and giving your time to hear about this issue and the impact of harmful marketing that is having on children. Following today's event, we'll send a link to the report to all registered attendees today. And for more information about VicHealth work, you can join the mailing list via the VicHealth website. Thank you and see you next time.